Hi guys, Dr. Michelle Choi here. Did you know that there's actually a medical condition called broken heart syndrome? Other names for this condition are stress-induced cardiomyopathy, Takotsubo cardiomyopathy, and apical ballooning syndrome. I've seen this a few times in my career, the idea that you can literally die from a broken heart. When there is a severe emotional or physical stress, like loss of a loved one, serious accident, a really bad argument, financial loss, intense fear, or receiving awful news, that feeling of emotionally being brokenhearted can literally lead to cardiac consequences and actually cause a broken heart. It can happen even if you're healthy, where there's an extremely stressful event that can have impact on your heart. In her book, The Fear Cure, Dr. Lissa Rankin talks about a 1971 review in the Annals of Internal Medicine, where George Engel compiled the accounts of 170 case studies of those frightened or terrorized individuals who died instantly. A woman seeing teenagers outside her apartment beating and robbing a bus driver died while phoning the police. A 35-year-old man accused of robbery told his lawyer, "I'm scared to death." Then he fell to the ground and died. A 45-year-old man about to give a speech apparently died of stage fright. A 72-year-old woman died after her purse was snatched. There were others from Engel's study that died from acute shock and grief. A 14-year-old girl dropped dead when told of her 17-year-old brother's sudden, unexpected death. An 18-year-old girl died right after being told that her 80-year-old grandfather, who had helped raise her, had passed. One of the owners of the motel in which Martin Luther King Jr. was assassinated collapsed and died from a cerebral hemorrhage upon hearing the news. It was first described in 1990 in Japan, and Takotsubo cardiomyopathy is named after an octopus trap, which has a shape similar to the way the heart looks when one develops this syndrome. Even though I'm Asian American and I love seafood, I literally had to look up what an octopus trap looks like. And it's essentially a funnel or cone-shaped container. And in general, octopuses enter it to take shelter, and they generally don't try to escape. In broken heart syndrome, the heart's main pumping chamber, the left ventricle, changes shape, affecting the heart's ability to pump blood effectively as a result of severe emotional or physical stress. Broken heart syndrome may be initially diagnosed as a heart attack, as most experience chest pain and shortness of breath. The symptoms and test results are similar, but further workup for these patients typically reveal that unlike a heart attack, their heart arteries look clean and that there's no evidence of blocked heart vessels in broken heart syndrome. In broken heart syndrome, the symptoms are like that of heart failure. Your heart literally enlarges and doesn't pump well, but it's temporary. Broken heart syndrome can lead to severe short-term heart failure, and patients are usually treated with heart failure medications. Most people make a full recovery after a couple weeks. And according to the Harvard Women's Health Watch, the precise cause isn't known, but experts think that surging stress hormones, for example, adrenaline and catecholamines, essentially stun the heart, triggering heart changes in the heart muscle cells or coronary blood vessels, or both, that prevent the left ventricle from contracting effectively. Broken heart syndrome occurs more often in women than men, especially after menopause. Death is rare, and rarely reported complications include arrhythmias, obstruction of blood from the left ventricle, and rupture of the ventricular wall. Don't you think that this is pretty remarkable? The idea that you receive something that's really shocking and that this overwhelming stress can suddenly cause your heart to go awry. The idea that really bad physical or emotional stress can cause a medical disorder, and rather quickly, when these stress hormones or catecholamines cause your blood vessels to spasm or dysfunction, resulting in your heart muscle tissue to literally become stunned, and that it becomes toxic to your own heart. And I think if one doesn't want to die right now, we should reconsider the impact of stress on our lives. I talk about broken heart syndrome because it's literally possible to die from stress or become severely messed up from stress. but we decide if this is permanent or temporary. Let's be honest, stress happens. That's the horrible thing about stress. It happens. There are things that we have to deal with in life that are presented into our lives, but we can control how we react to it. And controlling how we react to it is a learned response. Sometimes I wonder if when stress happens, if we spend more time and more energy empowering the stress instead of taking care of ourselves and empowering our own selves to deal with the stress. If you had to make a deal, would you invest in your stress or would you invest in your own self? What's the better investment? If you think something can kill you, maybe you're right. It literally can kill you. However, if we feel more strong than not, more full than empty, more positive than negative, maybe there's a greater chance that we can ride it out and look beyond this very moment. You are worthy of a beautiful life, and I hope you take care of yourself always.